Hi, it's Dr. Paul Satterlee with Allina Health EMS. I'm here today to talk a little bit more about Ebola and specifically to address concerns that have been brought up by our first responders and let you know what our opinion is from Allina and also what we're doing at Allina to try to deal with this potential risk. We've learned over the years that when a contagion breaks out, the fear is usually a bigger deal than the virus itself and that it spreads faster than the virus. While the risk of Ebola in our area is really low, we know the level of concern is high, and so it will be important to talk about this stuff. In the days and weeks ahead, we need to be vigilant and be ready for any infectious disease. Ebola is a minor risk compared to influenza, and we're about to enter the influenza season. So let's lay some background and a foundation of knowledge. What is Ebola? It's a virus discovered in Africa in 1976. There's a very good book called The Hot Zone, which explains a lot of this, which I just got done reading. It's a member of what's called the viral hemorrhagic fever family. It's a virus that causes fever and hemorrhage, and I think all of us know, or at least think about Ebola, we think about people bleeding out of their eyes. So viral hemorrhagic fever is one of the families that describes the virus. It's a serious disease. Other times that there's been an outbreak in Africa, the Ebola death rate has been over 90%. Compare that with influenza, which is somewhere between 5 and 8% in the United States. So you've heard about people in the United States who have gotten Ebola and lived through it. There's, like any other illness, there are sort of degrees of illness that occur. Some people get a mild form, some people get a very severe form. Other things that impact the mortality rate or the percentage of people who die from it include the medical care they're getting. So you can imagine that the medical care in Dallas is probably a little bit more aggressive and thorough than the medical care that people are getting in Sierra Leone. So it would stand to reason that while there's a 60% mortality rate in Western Africa, we may not see that high of a mortality rate in the United States if there were to be a widespread outbreak. This is a map of the current outbreak, and this outbreak's been happening since December of 2013. For the most part, it's these three countries that you see: Guinea, Sierra Leone, and Liberia. There had been some other cases identified in surrounding areas, but those countries have been taken off of the list, and the majority of the cases have been from these countries. There have been 4 cases in the United States, 4 of people that had gotten the illness and either come back with the illness, or 2 of people that had been providing care for those patients. So now you've heard about, I think, a total of 9 cases. Those are other people that were brought over specifically to be treated in the hospitals at Atlanta and in Omaha. But when they talk about 4 cases, they're 4 newly identified cases in the United States. But again, those people were either healthcare providers or had traveled from Western Africa. So let's talk about the signs and symptoms of Ebola. Unfortunately, it looks and acts a lot like influenza or a myriad of other illnesses that people get. There's a fever involved, there's joint aches, body aches, headache. Importantly with this is there's not a lot of respiratory symptoms, which for the most part might keep the patient identification easier when you're comparing it to influenza. There's much more diarrhea, vomiting, and stomach discomfort in an Ebola patient. Importantly, these symptoms all start somewhere between 2 and 21 days, typically around the 12th day after exposure. That's important because it gives us a time frame to know about when we have to be worried about people that potentially have come in contact. How is it spread? This is an area of debate, I guess. Most people, almost everybody agrees that body fluids, and nearly all body fluids, have the virus. And if you're exposed to it, you can get it from those body fluids. Now, whether or not it's intact skin or microscopic tears on your skin is unclear, so the smartest thing is to keep everything covered. I think the worry that I have is that people are going to get something on their hands that they're not aware of and then inadvertently wipe their eyes or touch their face, and that's going to be their exposure. The big question is, can you really get it from airborne? Now, if you coughed up a big thing of phlegm on someone, that's probably got virus in it. But if you were breathing and you were ill, the microscopic respiratory dropules that we all put out, nobody knows if that really has the virus. The speculation is it doesn't, because if you look back at all these people and family members that have been in the room with others with Ebola over in Africa, so very few of them get the illness unless they're dealing with the body fluids, particularly during the burial and the funeral rituals. So initially the recommendation was that you didn't have to worry about wearing an N95 or a PAPR. Now that recommendation has come out, but it's probably more based on worry and less based on science. I think most of the science still points to the fact that you cannot get this by pure airborne transmission like you think of with the common cold or with influenza. If you look on the slide, you'll also see that there's concerns about needle sticks. Well, that's exposure to body fluids. It's very much one of the things you have to think about. One of the things that we really are, I guess I'm grateful for with this illness, is that you cannot give somebody the illness if you don't have symptoms. I go back to other illnesses, again, like influenza, where you can be shedding the virus for a day before you ever develop any symptoms that make you realize you're ill. Not with this disease as far as we know right now. With this disease, you have to have symptoms, and if you don't have symptoms, you're not contagious. So if you're on an airplane and you have no symptoms, and 5 days later you develop Ebola, that means everybody on the plane was safe and not exposed. And unfortunately, what we're learning is that a lot of recommendations change. For now, this recommendation is fairly consistent, but it takes a vigilant group of people to keep checking recommendations and understanding what the new ideas are. So for now, without symptoms, a person is not contagious. Treatment of Ebola, unfortunately, there is not a magic medication that is widely available for everybody to treat this illness. Viruses are tough to treat anyway. As you'll know, there's not a great treatment for the common cold, which is another virus. This particular virus has had a lot of research around it over the past 40 years, and there is a novel drug made, but it's not FDA approved, and it's not something that the average person's ever going to be given because there's just no understanding of its safety. They have been giving people with Ebola the serum of people that have been affected and lived through Ebola, which means they have antibodies built up for it. That might be one of the things that we find to be useful going forward. Right now, the best treatment is just good ICU treatment with good nursing care, good blood pressure management, good electrolyte management, good hydration, and really dealing with all the complications that come from this, like bleeding and bleeding disorders. There's no vaccine for it. Most of the viruses that we worry about, we're working on developing a vaccine. Right now there is not one, although it's a high priority because it's felt to be one of the best ways to try to limit the continuing epidemic in Africa is by getting people vaccinated. So what's Allina doing to prepare for a potential Ebola patient? Well, as you've read in the news, Allina has identified Unity Hospital as the Ebola receiving facility and treatment facility within Allina. And that helps. It's very important because what it does is it provides a very focused amount of education and resources to one group of people who have volunteered to help with patients with Ebola, who practice continually using the safety measures, the body fluid protection, the personal protective equipment, all of those things. And I think that what we're learning is that the more you practice at that, the more efficient and better you can be. And therefore it's good that one group is going to be the focus group that will be using these PPE and dealing with these patients. What that unfortunately doesn't account for is everybody in the community and all the people like first responders and EMS providers that have to go to homes. So all of us that do EMS need to be vigilant and be careful and be smart. But as soon as we can, we should focus the care down to a very controlled setting with a dedicated group of trained people, and that's what we've done with designated Unity Hospital as the receiving facility. Every day we have an incident command system that is set up throughout the Allina system that's talking every day and dealing with anything that's coming up throughout the system, whether it be PPE, patient movement, communication with the community, communication with media. There's a lot going on around this, and we are dealing with this as any other incident that you would expect us to deal with every necessary leader involved as indicated. There's a dedicated page within Allina called the Allina Knowledge Network that we really refer all employees to, and that's a great resource. A lot of it is stuff that's built within Allina, but a lot of it comes from the CDC and the Minnesota Department of Health. And so I would refer anybody who can't get on to the internal network at Allina to check with the CDC regularly to evaluate what the new recommendations are. A couple of other resources that are important to know about. Our 911 dispatch center is using the Medical Priority Dispatch Emerging Infectious Disease tool to screen the patients that have concerning symptoms. With that, we would be able to get information out to our crews and back to the primary PSAP to alert them so they can alert the first responders that are en route to that home or that location. Unfortunately, it's not as efficient as you'd like it to be because you sometimes can't get a great history over the phone and can't really understand how sick a patient is. But it's a good first step towards making sure that anybody who comes into contact with that patient is fully aware of what they're dealing with and what the risks are. We're also working with our internal infectious control specialist. At any time, Allina Health EMS can contact them and get recommendations regarding facilities cleaning, truck cleaning, and PPE recommendations. So we have those resources available throughout the Allina system as well. We're practicing donning and doffing. That's one of the things that, again, I think puts people at greatest risk. The materials keep the fluids off of you, but then that transition is an opportunity for the fluids to find cracks and get onto open skin and that sort of thing. We also are working through building a process for how to remove the waste when we've done some sort of patient care and there's a concern that there was an infectious disease involved. We're also working on managing temperatures, and one of the newer things is understanding the best way to take a temperature in EMS. A lot of the tools that they use in the hospital aren't as effective in patients that are outside in a different environment or in the back of a vehicle, that sort of thing. So on a system-wide level, Allina Health has its incident command activation up and running, and we're working with supply chain on making sure we have the right equipment available. We've also had a long conversation about the ethics around management of patients with Ebola. And that boils down to if a person's at the end of their life and they have Ebola, are there times when you wouldn't do specific procedures because they'd be futile? And so there's very much a broad discussion around that within our system. Within Allina Health EMS, we've had long conversations about what are we going to do if we need to move a patient from one hospital to another. And we're conducting drills and exercising and conducting drills and exercises to make sure that our people are well prepared and comfortable with what they're doing. So in front of you is the list of personal protective equipment that we use here at Allina EMS. It's important to know that this will change. It's already changed in the last 2 weeks because of various forces, whether it be what you see people on TV wearing and the fact that some people have gotten infected while taking care of patients. So this is the list. Be vigilant and pay attention to the CDC recommendations because I think there's a good chance it'll change. The important thing here is that this is very much about keeping body fluids off of your person. That's where your biggest risk comes in. And when you take the equipment off, that allows that body fluid to get in between in the cracks and crevices. So donning and doffing is a very concerning point when it comes to safety. You'll notice there's less emphasis on respiratory restriction and respiratory protection. That is a CDC guideline. I want people to focus more on the body fluid aspect of it. So the summary for what Allina Health EMS and Allina System Office is doing for Ebola is we're working very hard in early identification and isolation. We're working on screening patients at points of entry, whether that be into the clinics, into the hospitals, or into our EMS system via the 911 call into our dispatch center. We're working on training to follow good infection control practices, finding the right equipment, following national guidelines, and we're reinforcing the importance of typical everyday infectious disease control measures like good hand hygiene. Those are the important things when it comes to any infectious disease. I want to make sure that anybody who works within the Allina Health EMS service area, any first responder, any law enforcement agency, anybody out there should feel like they can contact Allina Health EMS for any concerns, thoughts, or ideas. Ask any questions you have. If we can't answer the question immediately, there are tons of resources within Allina that we can access. Thanks again.